Hi, welcome to Gay Boy Guide. I'm Alex Vanderhook, and welcome to my new apartment, getting up close and personal. I decided to do a video response to Morgan's article, I Don't Know My Status. If you haven't read it, the link is below. First of all, I want to just start by commending Morgan for being so honest and being so vulnerable, and that's a really hard topic to talk about. It's such a common experience. My friends have been through HIV scares. I've been through HIV scares. What I related to most in his story was kind of the reassociation of shame with gay sex. And so I wanted to go through, I've got 4 things that will kind of debunk some of the anxieties that Morgan had, and hopefully make anyone who's going through that kind of situation feel better about what they're dealing with. So the first thing is that HIV is not a death sentence anymore. It's actually a very manageable disease, as much as diabetes is. And in some ways, it's actually easier to take care of. Having HIV and being positive simply means that you're going to have to take extra care during the day to make sure you're taking your medicine, to make sure that your immune system is as strong as it can be. Number 2, you are not dirty for having HIV. A lot of people feel really ashamed at first when they contract HIV, simply because it's almost like a public announcement that, hey, I've had sex before. But really, everyone has sex. Sex is a natural part of life, and the people you look up to, your role models. Beyonce has sex. Your mom has sex. Your grandfather. You know what I mean, though. Like, everyone has sex. I've had sex before. So, in case that was a secret to anyone, but, I mean, hopefully it's not. Now I'm blushing, I don't even know why. And just think, are straight guys ashamed of having sex with girls? No. If they caught an STD, would they stop having sex with girls? No, probably not. So why should a gay guy be any different? The third thing is that, as made clear by Morgan's story, you need a gay doctor. Like, I don't know what the hell Morgan's doctor was thinking in that story, but, first of all, I've never even heard of that test before where they swab your urethra. Like, I don't know what the doctor was testing for. I've been getting tested regularly for the past 3 years, and I've never had that test done. I don't know what disease he was checking for. Maybe some doctors out there can post in the comments what that was about. And secondly, for the assistant to be cringing, so Morgan is sitting there. He's just had this super painful procedure done, and the doctor asks, "Are you okay?" But isn't even asking Morgan. He's asking the physician's assistant, because the assistant is cringing so much and is saying he just looks like he's in so much pain. I can't even imagine. That's so unprofessional. Like, I mean, I'm not a doctor at all, but I would just think that would be a huge no-no in terms of medical advice and professional procedures. Thirdly, don't ever tell someone that they're high risk when they're going through so much anxiety. A gay doctor is going to understand what it's like to be gay on a day-to-day basis. They know that gay sex is not abnormal. It's not, hyper risky or dangerous. They're going to make you seem as though you're normal and that you're okay and that it's all going to be fine. A gay doctor is also more up to date on the types of medicines you need, the type of things you need to watch out for, and what kind of preventative measures you can go through in order to, be prepared for if you slip up or if you have sex without a condom, one time. They'll be able to help you with that. Which brings me to number 4, which is know what protection and resources are out there to help you be a safer, more well-adjusted young gay adult. Right now, the treatment education for certain diseases that specifically affect gay people is very lacking. Obviously, we're not teaching gay health in schools, so you're going to have to find out other ways, like this video, and hopefully in the future I'll be able to bring someone on to talk about PrEP and PEP. So PrEP and PEP are 2 drugs that you can take. PrEP you have to take every day. It's exactly like birth control. So instead of having a baby, you're just preventing yourself from getting HIV. There's a huge moral argument about, if if people use PrEP, they're going to stop using condoms, and less condoms is more unsafe sex, and it's more sex in general, and that's just not as safe. And it's kind of the same exact argument that's going on with birth control right now. People don't want women on birth control because it means they're going to have sex. I guess the idea behind it is that they don't want it to become like, oh, there's a pill for that. Like, you can just kind of be a little irresponsible and just like not worry about consequences or anything like that. But I kind of think if you're taking the active steps to get PrEP and to take it every day, then you're not being irresponsible with your health. You're actually being very responsible. The second medication I mentioned was PEP, which you can take the morning after. It's exactly like the morning after pill for girls, which is, oh shit, I didn't use a condom. I want to make sure I don't have HIV. You take it immediately after or the night after. It helps prevent you from getting HIV or contracting it. PrEP can also be used if you want to enter a serodiscordant relationship with, maybe you're negative and you've fallen in love with someone who's positive, or vice versa. I've also heard that you can partake in studies and get the drug for free, but just keep in mind that it may be a placebo and you may not be getting the actual medication. You may just be getting a sugar pill, but that's kind of how studies work. And more studies are being done with this drug, as it's still relatively new. And right now, PrEP is considered a combination HIV preventative strategy because you're supposed to use it with condoms. PrEP does not mean stop using condoms. It just means you need to be using it in addition. It's like taking the pill and using a condom, which is just like taking birth control and using a condom. You just want to be as safe as you possibly can. A lot of young people aren't using PrEP because they don't see a doctor. They don't have a regular doctor who can inform them about this, who can tell them about it, which again reemphasizes why it's important to see a gay doctor, because they will know about this and they can educate you on how to better take care of yourself. Again, I want to commend Morgan for sharing his story and for being so open and honest about it. Talking about this is not easy, and as any of us who have been through it know, it's something that can be very scary and very isolating, and that's kind of the last thing I want for anyone who's going through this, is to feel alone. So if you have any questions, or if you want to access any of the resources I talked about, I'll post them in the box below. And again, research PrEP, PEP, get a gay doctor. Thanks for watching. You can subscribe. And I think that's it. Have a great weekend.